Hello, welcome to the clinic. How are you doing today? Great. So, you are a first-time patient with us, is that correct? Okay, perfect. In that case, I'm going to go through some questions with you today regarding your general information and health history, okay? Just to get you filed on the system for your future appointments. Alright. Great. And I just need you to be as honest as possible with me when answering the questions, okay? But if you would prefer to withhold some information, I understand. But I can assure you that this is a safe space, okay? We want you to feel very comfortable, and everything that you share with me today will remain confidential. Okay, so before we get started with the questions, are you feeling okay? Can I get you some water or anything? You alright? Okay, just make yourself comfortable, and we will begin with the general information, okay? So could I just confirm your full name, please? Okay. Thank you. And your date of birth? Okay. Great. And what is the best telephone number to reach you by? Okay. 7. Okay. And your home address? Okay. Zip code? Okay. City? Okay. Thank you. And what is your email address? Okay. At Gmail. Okay. Great. And who is your insurance provider? Okay. And do you have the details of your previous doctor? Okay, what's their name? Okay. Yeah, that's fine. Do you know the clinic they're located in? Perfect, okay, thank you. Alright. And do you remember the date of your last physical exam? Okay. Do you remember the month and the year? Okay. Great. And what is your marital status? So are you single, partnered, married, divorced, or widowed? Okay. And how do you classify your gender? And what is your highest level of education or degree? Have you graduated high school? Okay. And have you gone to college? Okay. And what is your current occupation? Okay. And who is your employer? Alright, yeah. We just might need to get in touch with them at some point. Do you have their contact details? Okay, great, thank you. Okay, perfect. Now, we're just going to move on to your health history, okay? So, do you know your current weight and height? Okay. Thank you. And I'm just going to list some general health conditions, and please just say yes or no if you currently have these or if you have had them in the past. Okay. So severe headaches or migraines? if you were to rate the pain with those on a scale of 1 to 10, where 10 is the highest, what would you say? About a 4. Okay. Alright. And what about asthma? Okay. Arthritis? Okay. Cancer? Okay. Diabetes? Seizures? Heart disease? Heart attack? High blood pressure? High cholesterol? Heat spells? Stroke? Any thyroid problems? Hepatitis? Or sleep apnea? Okay. Great. And do you have any family members on your mother's side who experience those conditions? Okay. And who is that? Alright. Okay. And what about on your father's side? Okay. Thank you for that. So I'm just going to move on to our next page here. So now we're just going to go through some symptoms for various different areas, and if you could just say yes if these have applied to you within the last several weeks, and no if they do not, okay? Alright, so starting with your ear, nose, and throat area, have you experienced any recent congestion? Okay. Dental problems? Okay. Any ear discharge? Okay. Ear pain? Any facial swelling at all? Okay. Any hearing loss? Okay. Mouth soreness? Nosebleeds? Postnasal drip? Sinus pressure at all? And a sore throat? Okay. And any trouble swallowing? Alright. Moving on to your eyes, have you experienced any eye itching? Okay. Any swelling at all? Eye pain? Redness? Glaucoma? Cataracts? Any eye injury or surgery, such as laser treatment? Okay. And have you experienced any recent vision loss? Okay. Okay, so now, just regarding your respiratory system and cardiovascular system, okay. Any chest tightness? Okay. Choking? Excessive coughing? Any shortness of breath or difficulty breathing when walking or laying down? Okay. Wheezing? Okay. And do you often experience an increased heart rate? Okay. Do you find that it increases while you're just sitting still at all? Okay. Any chest palpitations? Alright. So, any muscular problems? Okay, how about back pain? Alright. Joint swelling? Any neck pain or neck stiffness? Okay. And how about muscle cramping abnormally? Alright. And how about any skin color changes or strange rashes or wounds? You haven't noticed anything? Okay, good. And how about any neurological problems? So facial asymmetry. Okay. Headaches, you mentioned slightly. Okay. Lightheadedness. Okay. Numbness or speech difficulty. Okay. Or facial weakness or drooping. Okay. Alright. Just moving on. So, have you experienced any other pain or discomfort anywhere that I didn't mention? Okay. And could you just describe that feeling? Okay. Yeah. Okay. Alright, thank you for letting me know. Of course, if there is anything else you would like to mention while we go through the questions, just bring it up, okay? So, can you please let me know about any operations or surgeries you've had in the last 5 years? Okay. Okay. Anything else? Alright. Yeah, it doesn't sound too major, so that's good. Okay. And are there any other hospitalizations I should know about? Okay. And when was that? Alright. And that's better now, isn't it? Okay, good. Great. Okay, and do you have any medication allergies? Okay. And please, can you just list your current medications or any vitamins that you're taking? Okay. Great. And what's the dosage on that? Okay. Alright. Yep, okay. And same thing, the dosage on that one. Alright. Thank you. And what about vitamins? Yeah, okay. Good. Anything else? Oh, yeah, okay. Good. Alright. And now we're just going to go through your health habits, okay? So, how often would you say you exercise per week? So, 0 days, 1 to 2 days, 3 to 4 days, or over 5 days? Okay, that's good. And what kind of exercise do you typically do, and for how long? Okay. Good. Oh yeah, okay. That's really good. Yeah, I recommend at least 30 minutes a day. Yeah, that's really good that you're getting a variety in though. So, let's see. Do you follow any particular diet or meal plan? Okay. Not really. Okay. Would you say that you eat a well-balanced diet? Okay, good. Yeah, no, that's good that you're trying. Do you have any dietary restrictions at all? Okay. Good. And can you just explain to me what you typically eat in a day? So what do you like to have for breakfast? Yep, okay. Sounds delicious. And what about lunch? Okay. Oh, you like to have a snack too? Yeah, of course. Smaller meals can be good as well, rather than larger meals less frequently. Okay, what about dinner? Do you like to cook? Okay, what do you typically make? Oh, great, okay. Yeah, I just want to get an idea of what you are typically consuming, but that all sounds fine. Okay. Is there anything you'd like to change about your diet, or are you generally quite happy with your current intake? Yeah, good. Okay, and do you drink alcohol? Yeah. What kind? Okay. And about how many units would you say you typically drink per week? Okay. And what about caffeine consumption? Coffee and tea? Okay. How many units per day would you say? So 1 to 2 cups a day, 3 to 4 cups a day, or 5+ cups a day? Okay, that's fine. Okay, and do you smoke? Okay. And do you use any recreational drugs? Okay. And are you sexually active? Okay. Are you trying for pregnancy at all? Okay. And what contraceptive method do you use? Okay. And have you ever been diagnosed with any sexually transmitted diseases? Okay. Alright, moving on to our last page here. So, I just have a couple of questions regarding your personal safety that I just need to ask. So, do you currently live alone? Okay. And do you experience frequent dizziness at all? Okay. Okay. And do you experience any vision or hearing loss? I know I asked earlier, but just to double check. Okay, good. Sometimes that can be dangerous when living alone, so we just need to make sure. But that's great. Now, the last set of questions is just regarding your mental health, okay? So, would you say you experience a high amount of stress? Alright. And what do you think that could be attributed to? Yeah. Okay. Yeah. Okay. And do you feel depressed? Right. And do you panic when stressed? Okay. And do you ever experience a loss of appetite? Okay. do you cry frequently? Whatever frequently means to you. Okay. And have you ever had any thoughts or actions related to self-harm? Okay. Have you ever had any suicidal thoughts or attempts? Okay. Do you have trouble sleeping? Sometimes. Okay. Do you find anything that helps with that? Okay. Yeah. Do you experience agitation or irritability? Okay. Behavior related problems? Okay. Do you have trouble concentrating for long periods of time or short periods of time? Okay. Do you experience hallucinations? Okay. Any nervousness or anxiety? Okay. And have you found anything to be helpful with that? Okay. Yeah. Okay. And have you seen a counselor in the past? No. Okay. All right. Please, let me know if you'd be interested in speaking to someone, and we can always refer you. Yeah. So those are all of the questions that I have for you today. Thank you very much for your time and honesty in your responses. Okay, I really appreciate it. Is there anything else that you'd like me to make note of? Okay. Yep. Alright. Okay. Well, I will get this filed away onto the system, okay? And I will see you again when you come back for an appointment. Alright. Well, thank you very much for coming in, and have a great rest of the day, okay?